Welcome, Attorney General Stein, and we hope you will enjoy your time with us here today as we discuss the opioid settlement and how we in Dare County are using these funds. We have a number of distinguished guests and elected officials present here, including mayors, chiefs of police, town and county managers, judicial officers, sheriff's office, department heads, clergy, providers, county commissioners, and others, including members of the Saving Lives Task Force. I'd like to recognize my fellow Dare County Commissioners, Chairman Bob Woodard, Ervin Bateman, and, well, they couldn't be here, Jim Tobin, there he is. Commissioners Rob Ross and Steve House and Danny Couch had other commitments and could not join us today. On behalf of the Saving Lives Task Force and all of Dare County, I want to thank Attorney General Stein for all of the work that he and his office did to secure the opioid settlement funding for North Carolina. Our own county manager, Bobby Outen, worked on a committee representing the counties in the settlement as well. Bobby's also our county attorney, as you know. Also, thanks for making the bulk of that funding directly available to the counties and municipalities throughout the state. We feel that this was an important step because local entities are intimately closer to the problems created by substance use disorder and the resultant mental health issues, including suicides, adverse childhood experiences or ACEs, increased pressures on the judicial system, law enforcement, and school systems, as well as increased stigma and a loss of resiliency. Dare County has a number of task forces and committees and organizations working together to try to help with these issues. We are blessed to have a caring population willing to give their time and efforts toward working on this problem and making resources available to all concerned. This includes some programs that, while possibly not unique to Dare County, few others are doing. We have made considerable efforts to get out ahead of these issues, although we recognize that we are dealing with a moving target and must remain flexible and retain the ability to respond quickly to the ever-changing dynamics of substance use disorder. We created the Saving Lives Task Force in 2014 to work primarily on the drug issues directly or indirectly plaguing our school-age children. That was 8 years ago, and the primary efforts then were on education and prevention. Within a very short time, we recognized that the task force needed to evolve into a larger scope of operation to include all ages and include treatment, harm reduction, and recovery in our efforts. We then had a more comprehensive approach to our work. The task force has an open door policy to anyone who wants to be part of the organization. We have participation by concerned citizens, people in recovery, providers, clergy, our school system, law enforcement, Vidant Hospital, the judicial system, Trillium, Port Human Services, and others. Additionally, the Saving Lives Task Force strategic plan is aligned with the North Carolina Opioid Dashboard. As you're aware, Dare County will receive about $3.4 million over the next 18 years. And we have already begun the process of distributing the first tranche of this funding. You will hear more details about this later from my Saving Lives Task Force co-chair and Health Department Outreach Director, Roxana Ballinger. So with that said, please give a Dare County welcome to Attorney General Josh Stein.
Commissioner Overman, thank you for those kind words of welcome and introduction. Basically, he took my speech, just said everything. It was perfect, and I appreciate that. I thank all of you for taking the time to be with us today to talk about what is the deadliest drug epidemic in American history, and tragically, we are at the deadliest moment in the deadliest drug epidemic in American history. The number of people who died of a drug overdose last year exceeded 100,000 people in this country, 108,000. We've never approached anything like that before. It was a 15% increase over the year before, which was a 40% increase over the year before that. It's just spiraling and spiraling, and it's heartbreaking. North Carolina is not immune, and as you know well, Dare County is not immune. Y'all had 15 overdose deaths and 61 emergency department visits in 2020, and I know that 2021 was a harder year than 2020. So we're at this terrible moment, but how did we get here? And tragically, this crisis was born by greed. Greed of these pharmaceutical companies that spent great effort to try to convince the medical profession that opioids were the most effective way to treat pain and they were not addictive. And of course, we now know that neither of those things are true. They are not the best way to treat pain, and they are highly addictive, as millions of Americans now can attest. So I helped put together a bipartisan coalition, national, nearly every single attorney general in the country, to take Purdue Pharma, the Sackler family, and other drug companies to court, and we're winning. We've won $26 billion in the national opioid settlement, which we announced last year. We have another $8 billion in settlements in principle with 3 other generic drug manufacturers. The $26 billion were the 3 drug distributors and Johnson & Johnson, a generic manufacturer. We have 3 other generic companies, so hopefully we're going to get another $7 to $8 billion from them. And then we have other cases that we're either investigating, litigating, or in settlement negotiations with, so that my hope is that there will be substantially more resources than even the $26 billion that have been secured so far. Of the $26 billion, our state share is $750 million. And I want to thank Bobby, the county manager. He was part of this 555 committee, which was 5 managers, 5 commissioners, and was it 5 health directors? 5 commissioners, 5 attorneys. And 5 managers. Yep. So did you wear both hats? What did you do? Okay. That's not fair. Then they had 6 attorneys. And no wonder we got such a bad deal for the state. No, we had incredibly constructive discussions, and we had a shared goal, which was to help as many people live a healthy life, free of addiction. And so with that as our North Star, we decided that of the $750 million, 85% would go to the counties and 15% to the state. And that was a decision which, by the way, no other state made. This was something that we chose to do here. Other states, much heavier percentages went to the state government. But we recognize that this is a crisis that's born at the local level, felt at the local level, and addressed at the local level. It's your county jails. It's your EMT. It's your social services. It's your public health departments. Y'all are the ones who have to deal with it. And so we wanted the money to go local because we thought it would be more effective, and each county is different. Some counties have certain assets and others have certain gaps. And each county's response can now be localized because the money is coming to you all. And as Vice Chair Ervin said, the share coming to Dare County is $3.4 million over the next 18 years. Already, or in year 1, it's going to be about $420,000. 2/3 of that money has already been paid. The next third's coming very shortly. And how you all use the money is up to you, provided that it's within 4 broad categories: prevention, treatment, recovery, or harm reduction strategies. And as I said, certain counties have certain needs, and they will direct a greater percentage to those broad categories than others. Within the categories, what that means in real terms, in real programmatic meaning, is evidence-based addiction treatment, like medication-assisted therapies. It means post-overdose response teams. It means recovery services, employment, transportation, or housing. It means naloxone distribution. It means diversion, criminal justice diversion, moving people with addiction out of the criminal justice system and into the healthcare system where they can get treated and well. It means addiction treatment for people in the county jail so that when they get out, they get connected to outpatient and then they can continue their recovery, their path to recovery. So there are all kinds of potential examples of activities. And what we've been doing is having meetings like this with counties across the state, from the mountains here to the coast, everywhere in between, rural and urban, to find out how are you going to use your money? What is your strategy for deploying the money? And a number of them said, we don't know how we're going to give it out, and we're not going to give it out till next year because we're in the midst of a comprehensive strategic plan to assess what do we have and what do we need. And what I just heard and what I know is you all are kind of ahead of the curve, right? You've been doing this work for so long, you already had a strong strategic plan. And I've heard some of what you're going to be doing, and what this session is about is hopefully to learn more about what you're doing, and I'm eager to hear the ideas and programs that you're funding. So regardless of what you all do, regardless of what the state does, it has to go to attack the crisis. And what's very important is that the people have confidence that this money is going to be well used. When we did this, brought these cases against the companies, we wanted to hold them accountable and to make them pay for the damage that they did and the money that they won or took. So that's $26 billion, but the money isn't enough. We wanted to actually mean something in the lives of our people. And for that reason, every government has to disclose every year, who did you give the money to, how much did you give them, and what were the impacts? What difference did it make in people's lives? Because not every strategy is going to work. We recognize that. Some are going to be better than others. And we want you all to have that impact, that information, so if you need to modify your approach midstream, you can do that. And that it's all going to be on a website. It's ncopioidsettlement.org, ncopioidsettlement.org. We call this the Community Opioid Resources Engine of North Carolina, Core NC, and it will have this accountability dashboard, but it also has chock full of very useful information about all the data of prescriptions per capita, opioid overdose deaths per capita, ED visits per capita. All that information is there to help you all figure out the best ways to use your money. And there are also ideas of what's going on in other counties, because folks don't need to reinvent the wheel. We actually know a lot of what works, and so those are also included on the website to inform you. As I said, I'm very eager to hear the presentation from the county about things you all are considering with your funding. What I have done is I've done these travel the state and had these various meetings is come across just an incredible array of passionate people, people who are so motivated because they have their own story of recovery, or they have their own story of sorrow where they lost someone. And then there are other people who just, this is what their heart tells them to do, is to help people. And when you find people so motivated, who have such big hearts and such passion and such creativity, and then you can combine that with this dedicated source of funding, we know it's going to affect people's lives in a positive way. We know that there will be more people alive and healthy next year in Dare County and the year after that than otherwise would have been. And that's what I'm so eager to see happen here in North Carolina. And I'm eager to do this work with you all in the months and years to come. And also eager to hear what you have to say as we continue this meeting. Thanks for having me.
Okay, next up is Sheila Davies, our Director of Dare County Health and Human Services, will speak about public health planning process. Thank you, Sheila.
Good afternoon. Attorney General, thank you so much for the championing efforts that you've done and what you led. This was certainly monumental legislation and a monumental settlement. And we were certainly thrilled to follow it. We were happy that we had Bobby Alton championing for us as well. And the outcome for what this will do in our community is certainly remarkable. A lot of what you said in your presentation, even though you said Wally took it from you and then now you took it from me. So anyway, we're passing it along. But we are fortunate with the community in Dare County and the passionate folks that are working on substance abuse in so many different ways that I feel we are leaps and bounds ahead of where other communities. And we're really fortunate because this work has started and been going on for years. And it's, moms who have lost babies, and it's siblings who have lost siblings, and it's family members who have witnessed individuals, the devastation and the toll, from the emotional toll to the financial toll, the struggles. They're the ones doing the work in Dare County, and it's making a difference. When we first started holding meetings about discussing what we would do with Dare County with these funds, we recognized there's never enough money to go around, and that it did become a prioritization process. Where do we think we can make the most impact in our community? And so my goal today is to kind of just share a little bit about the process and how we got to making recommendations to the county commissioners, who ultimately adopted the funding plan for this particular fiscal year. And as you indicated, we will be putting a plan together every year that would then be vetted with the community and then back before the commissioners. But for the current fiscal year, a little over $400,000 has been allocated. And before I go over the specific ways the money's been allocated, I'll share the process. So when we first heard of the amount that Dare County was getting, and then the annualized amount, we were able to start working with different stakeholders in the community to get some input. We had some ideas in public health because we've been really involved in this work in multiple ways, whether it's through peer support specialist or our justice grant, and through just lots of programs. We've been really involved for years, and Roxana Ballinger is a community development specialist or director within the public health division. We had a conversation with the sheriff, we had a conversation with Chief Collins, with EMS, and then we started meetings with our specific stakeholder groups. We have a Breaking Through Task Force, which is something that was created out of our Healthy Carolinians of the Outer Banks and the Community Health Needs Assessment. That task force focuses on breaking down the stigma of mental health. So while we have Saving Lives for substance abuse and Breaking Through for mental health, but several of the members are on both committees, which is the way it should be because neither of those happen in silos. But we first took a kind of a rough plan to the Breaking Through Task Force to get their input. After that, we took it to the Saving Lives Task Force, and that particular meeting was a special called meeting, and there were probably close to 40 people in the room. It was a very well-attended meeting. From there, we took it to the Healthy Carolinians of the Outer Banks Partnership Board, their executive committee. That's made up of a diverse group of stakeholders throughout the community, the medical community, the schools participate, EMS participates, private providers, and general citizens participate. And at each meeting, again, we heard that we wish there was even more, but we were grateful, certainly, for what was being offered. And we were able to refine what we were putting together and packaging as the plan to take to the commissioners. We also, so between those meetings, it was close to about 65 people that we were able to put the plan in front of. And then we, because a lot of these meetings are recorded and televised, we also were receiving comments from the public or from other individuals who maybe couldn't make a meeting but had feedback that they wanted to share. Ultimately, we landed on allocating these funds in multiple categories, and I'm going to run through the overall categories, and then in a little bit, Roxana is going to come up and share in one particular category in particular that we're really excited as a part of our program. And in alignment with what the Attorney General shared, every single one of these initiatives matches one of the exhibits in the Memorandum of Agreement. So it's aligned perfectly with what the state is expecting for us to do in our community with the funds. So funding was allocated for an overdose response coordinator, for a probation officer for recovery court, for expanding naloxone community distribution, for fentanyl testing strips for community distribution, for a Fentanyl Kills Mass Public Awareness campaign. And I'll pause with those two things because those are two of the newer initiatives that we haven't, we either just started or haven't been doing. And one of the things that you mentioned was, in some ways we know what's going to work, but in some ways we don't. And this is an opportunity to try things. We're not really sure how effective it's going to be with the testing strips, but it's one of these initiatives that we want to try, because if it does save a life, it makes a difference. And that's another reason that these initiatives will be reevaluated each year to say, what's working really well or what didn't work. And if something didn't work, then that money can be allocated to another purpose that falls within the allowed exhibits. Another component is linkage to care coordinator, social determinants of health. It's actually not a coordinator, it's the support that goes along. So when we're working with someone who's in recovery, if they need additional support, whether it's getting into a treatment facility, whether it's transportation, whether it's a housing situation, those funds can help support those individuals. And then one of the initiatives that grew through the process and became a much larger pot of money to distribute is what we're calling community initiatives, and it's $125,000 that's been allocated for that. And Roxana will go into details with the awardees, but it was to put the money into the pockets of the community organizations and entities who are doing grassroots efforts or grassroots initiatives to help, basically build your army that's working against battling this issue, because not one entity can do this alone. And so it's something that I think originally was a much smaller amount, but then after the feedback from the community, it grew to the amount of $125,000. And I think that that's something that when we look back on and see where did we find the greatest bang for our buck, I do believe this is going to be one of those initiatives where we see that. So I'm proud to live and work in a county where we have so many dedicated and passionate individuals. A lot of them are sitting right behind you in that row. They're the ones that are making a difference in this battle, and we just appreciate our part in it and the service. So thank you again for championing for our state and for the people here. And I think I'm turning it over to Roxana. That's what I do. So thank you.
I got to move this mic down a little bit, so sorry about that. Thank you, Attorney General, for being here. And as Sheila said, we are very appreciative of this funding. It's going to do a whole lot. The Saving Lives Task Force has many ongoing activities in DARE to address the opioid crisis, but it could not be done without the partnerships and collaboration of other departments, agencies, committees, and task forces, including our recovery and faith community. Since our inception in 2014, we have held 21 town halls or educational events for the community and the medical providers in DARE, from syringe exchange programs to controlled substance reporting system to medication-assisted treatment. We collaborated with Source Church in 2016 to start North Carolina's second syringe exchange program. We recently held a suicide town hall in partnership with the Breaking Through Task Force, which focuses on breaking down mental health stigma, and the Be Resilient OBX initiative that focuses on building a resilient and trauma-informed community. Over 90 people attended this, and it was a great success. On November 3rd of this year, we will be hosting with our Faith Leader Subcommittee and partnering with the North Carolina Council of Churches to host a substance abuse and mental health educational and awareness event for faith leaders to engage them in the opioid crisis and how they could make an impact. Over these last years, since we started, the faith committee, that community has always been a gap And I'm really happy to say over the last 2-3 years that has really grown, and I feel like that really has become rooted now. We want to engage them in the opioid crisis. We all understand the importance of how substance use disorder, mental health, resiliency, and our faith communities are to combating this crisis. We continue to build upon this and add more resources to our toolbox. In September of 2018, we started a pilot overdose response team service with the town of Kill Devil Hills in response to the highest number of overdoses there. We quickly saw the need for this and quickly expanded to the entire county to meet this need, and today we have the Recovery and Overdose Response Services, or ROS, as we call it. ROS is more than just overdose response. It's comprehensive. It's about the journey and providing basic needs and having a supportive contact to facilitating entry into treatment, recovery groups, harm reduction, by providing naloxone and fentanyl test strips and connecting them to our syringe services program with the community care clinic. ROS is managed by our 2 peer support specialists. They work closely with EMS, law enforcement, many partners to help those who struggle. It truly takes a village to make this happen, and DARE is that village. We, our PSS, peer support specialists, created the Eastern Carolina Harm Reduction Coalition in May of 2022. That includes Hyde County, Beaufort, MTW, and Currituck counties. They also created a fentanyl test kit, which includes test strips, instructions, and contact and resource information if they want to reach out and get help. I had to bring this to show this. Probably everybody in this room has seen this, but I did want to share this with you. Yeah. The kit contains fentanyl test strips, but it also contains good detailed instructions, and then it also contains where they can reach out if they want to ask questions, if they want to help, whatever it may be. So far this year, we have distributed 776 naloxone kits, 566 fentanyl test kits to the community, to law enforcement, professionals, and other partner organizations. The Saving Lives Task Force started a newsletter in 2017 called The Initiative to educate and keep the community informed about what's happening. It's published quarterly and addresses all topics related to the opioid crisis. As part of the approved opioid settlement funds, $125,000 was allocated for community initiatives. The county manager and the Board of Commissioners directed the Saving Lives Task Force to implement a process on how these community funds would best be used. A grant application process was chosen and was open to all entities in Dare County involved with the opioid crisis. 10 grants were awarded, and I'll read a summary of those. Interfaith Community Outreach, we awarded them $5,000 to help with monetary assistance, to help people with rent, mortgage, and security deposits, and unfortunately, to assist with end-of-life expenses for those individuals who did die from the overdose. The Community Care Clinic of Dare is going to implement medically assisted treatment for opioid use disorder, specifically Vivitrol, which was a gap in our community. Just In Case is a nonprofit, and they were awarded $2,500 to provide fentanyl test strips, Narcan, in a discreet manner in the form of a vending machine. Outer Banks Room in the Inn was awarded $10,000. The goal was to fund mental health first aid trainers to address this mental health awareness and need in our community. Crossroads OBX was awarded $12,500 to continue their work and help maintain their capacity to address substance use disorder, help with psychological support, life coaching, and spiritual connections. Dare County Recovery Court was awarded $25,000 to support their recovery as they integrate back into the community, with Oxford House admission fees, counseling, and co-pays that are needed for substance use disorder counseling. And also to expand Recovery Court's drug testing program by adding possible laboratory analysis and hair testing to their current regime. Changing Tides, which is a treatment facility here in Dare, was granted $24,000. This grant would allow for tuition for individuals to come to their program. Outer Banks Yoga, which is an evidence-based program, they have designed specifically for individuals in recovery from drug addiction. Yoga is increasingly being used in substance abuse treatment and recovery programs to help prevent relapse, reduce withdrawal symptoms, and drug cravings. We awarded $3,750 for a contracted peer support specialist to continue her work with the Recovery Court, working with women's recovery groups, attend Recovery Court sessions, and work with the Dare County Detention Center and continuing to promote those programs. Outer Banks Dare Challenge was awarded $15,000 to continue their focus on helping students reintegrate back into the community, giving them the tools necessary for long-term success, and partnering with the College of the Albemarle to increase their educational needs. We are very fortunate to have an engaged and passionate community, as well as supportive leaders and supportive Board of Commissioners. None of these things could happen if we didn't have this. I know so many other counties don't have that, and I always think about that, and I'm so grateful. These grants are all needed services and will make an impact and improve the lives of many in Dare County. Thank you. Thank you.
Appreciate it. Thank you. Next up will be some justice updates, and we have Emily Urch, who is our Recovery Court Coordinator, Ervin Bateman, who's a Dare County Commissioner and works in the recovery community, Doughtie, our Dare County Sheriff, and who I always say is the best sheriff in North Carolina. He don't like me to do that, but I do it anyway. And I don't know, Judge Tillett was going to try to rearrange his schedule. I don't know. He wasn't able to do that. Okay, so he's our Superior Court judge who handles the Recovery Court. So if you all would come forward, I appreciate it. Thank you.
All right, I'm short too, Roxana. So thank you all for being here, and thank you, Attorney General. Like Mr. Oberman said, I'm Emily Urch. I'm the director of the Recovery Court. We have been in operation since March of 2019, and in that time period, we have had 27 successful graduates, and we currently have 40 participants, plus 6 who are in their step-down active monitoring stage. And that may not sound like a lot, 27, okay, Emily, but it takes most people at least 2 years to get entirely through the program. Also, all of our people come from the Superior Court, so they're all felons. Some of them are pretty high-level felons. They've got serious drug problems, and we've actually seen a big switch from the heroin and the opiates to the methamphetamines, which has been, unusual. I practiced law here for years, and, in 2014, I'd see 1 meth case. Now we see 1 million. So things are changing, and we're also changing to keep up with that. But I think Roxana did mention that we are going to be able to hire another probation officer, so that's great. We could probably double our caseload. And we certainly do have enough people coming through the court system with drug charges to do that. And we get our people, we get them post-trial, we get them pre-trial as well. So the way it would look for a pre-trial person is they get arrested, they're generally in active detox, they're in jail, and the jail staff or an outreach worker with the health department will alert me, this person needs help. They don't need to be in jail. I get all their information, take it to Judge Tillett. He can modify their bond to allow them to go to a treatment center. And as long as they're there, it'll be unsecured. Once they graduate, they can come back and take care of their cases. They're back here in Dare County for the most part. They're on an intensive probation. We've discovered that frequent drug testing works, and also what Judge Tillett calls the carrot and the stick approach. And the stick is obviously, if you mess up, you could do a little jail dip, but we also give rewards for people who are doing great. And like the Attorney General said, this is all at the community. And this has all been funded by people in Dare County. We've got the Walk Against Addiction. She helps with little gift certificates when they're doing well. She helps with their admission fees. So the money that we're going to get is also going to just really expand on that. Everybody in the county has been really, really great about showing support. We have counselors and therapists who are willing to work on a reduced rate, but we also now have the money from this mini grant that's going to be able to assist our people coming out of treatment with their outpatient needs. We've got several counselors and drug therapists on board in the community that are going to be willing to help us out. And we've got an insurance agent who's going to be able to help them get, insurance through the marketplaces. We've got restaurant owners, we've got cab drivers, all these people that just come together to make sure that our participants can be successful in their recovery, get to their probation meetings, get to their court sessions. Judge Tillett sees them about once a month, and it's really nice, I think, for our participants to hear from him, the Chief Resident Superior Court Judge, you're doing a good job, and keep it up. So that's a little bit about what we're doing. It's like a really small cross-section of what can be done in the whole county. We're serving these people with felonies, but there are people out there who never make it to the justice system that also need help. So that's going to be really instrumental. And Ervin Bateman has been a huge champion and supporter, and he comes to all our meetings and has probably seen firsthand what we're doing, if you have anything to add.
Okay. Judge Stein, I guess hearing our Health and Human Services Director, hearing Roxana, hearing Wally, I guess you got the opinion and the understanding that Dare County suits up, we show up, we roll up our sleeves, and we do what we got to do to address the issue. I appreciate all that you've done behind the scenes to try to get this thing going. We appreciate the funds and the money. I will tell you this, that the underlining goal is to make sure that anyone who wants help can get it. And that's what we're working behind the scenes trying to do, to give you a blow-by-blow play how it can work. Say, for instance, our sheriff arrests somebody, he's in the county jail. By the way, he's not the best sheriff in Dare County or the state. He's the best damn sheriff in the United States. And that's the truth. I mean, but anyway, so he arrests somebody, he puts them in Dare County jail. And then what happens then if this person wants help? They contact Emily, or contact their attorney and say, I need help, I want to do something. We'll have a social worker go in there. We'll find them a treatment center. We'll get them in front of Judge Tillett, as she said. We'll get them to that treatment center. They'll get their self fixed mentally, physically, and then we'll bring them back and put them in recovery court. And they'll stay in there for 18 months. And in that time, I've seen guys come in who I've seen on the street that are broken. They can't even make their own bed. They're completely down in life, and they gain their confidence back. That's what recovery court does. It's a very intricate part of how we can make and change these people's lives. When the judge says, you did a great job, I'm proud of you, they beam because they're so happy. I had one guy tell me one time he felt guilty for relapsing because of the fact he let the judge down. That's big. We're talking about a judge. So anyway, we're having graduation, and I want you to come down. I know you're a busy man, but the 2nd of December at Sugar Creek Restaurant, we're having a graduation for all the... Everyone. that's been through the program, the ones that are backers of the program, we're going to have them there, and we're going to give them a great meal and let them see and let them beam with the enthusiasm they have for life now that they did not have before. So that's all I got.
That's great.
Yeah.
Attorney General and everybody in here, if everybody could get up and talk, you'd see the same thing in him, in all of them. And that's the only thing that makes Dare County exactly what it is. There's some passionate people here that do this every day. You can sit down there. I just want to tell them how nice. But, you know, you can't find people like that ever. You know, they are just very compassionate, passionate to, you know, the nth degree about what they do. And it's everybody. You know, we either start, us, law enforcement, we either start at the first end of that or we're at the back end of that. Problem is, you know, that middle, it gets lost a lot of times. But because of these people that, you know, are in that middle, it makes our job a lot easier. So we can either, you know, help, we'll, you know, I mean, if they need to be arrested, they're going to get arrested. And we don't mess around with that. They're going to get what they deserve. But, you know, I've got 7 guys that run a drug task force here that I'd put up against anybody in the state. No doubt. We're not big in number, but we're big in heart. And they know they have a vast amount of knowledge. They know what they're doing, and they've got good partners all the way across the, you know, where we work. And we've done cases of work as far as Arizona, you know, with the federal government. We've got people sworn with every federal agency that we can do with, you know, the different ones that help us, the FBI, Homeland Security. I think we've got one with the DEA. So, and we've got NAGSED and Kill Devil Hills that, you know, offer manpower. So we've got a great working relationship with, you know, all the entities, but those guys put up. Chief, both of those chiefs are here, the chief from NAGSED, the chief from Kill Devil Hills, and they don't mind working, you know, and we've stole one of their men, you know, each one, and you know, it makes a big difference. It really does, helps us out. But like I say, in the middle, we've got, there's a couple of my people that are involved in the different entities that, you know, that we've talked about. I think one of my guys is on the board with the Recovery Court. There's one of my guys is on the board with the Saving Lives Task Force. So, you know, we spread it. And then there's another young lady that is she's involved in, I think, every group that probably Dare County has in some way or another. That's what she does. She truly is a worker and will volunteer for anything and does a great job. And she's actually employed by us. But, you know, through some grants that we've gotten, you know, we've got a young lady that works with the health department, but, you know, does a lot for my jail, the detention center, and she's been an integral part of getting money in there. So we're realizing that, you know, there's some mental health there that we've gotten, you know, through that we didn't have. Which is a great, you know that. I mean, you're in jail and you've got some mental issues. We've got a problem to begin with on top of all the drug issues that come in. It's just, you know, it makes that life in there tougher. So we've been able to do a whole lot of stuff with that. We're just very fortunate to have the system that we have and the people to rely on that don't mind doing the job that they do. And we kind of make sure, I mean, you know, if they need us, we're there. If we need them, they're there. And, you know, it makes it that much easier to work. I will say that, you know, I don't know, over the past, at least, I think the new law with the death by distribution came in 2019. We've charged 4 individuals with the death by distribution. Getting ready, well, I had 3 right now, getting ready to charge another one very shortly. I don't say that to be, you know, to be proud of the fact that we're, you know, that we have to do that, but I'm very proud of the fact that I've got guys that work that hard enough, you know, to find out, to put all that together to make sure that they can and feel like, you know, they have done everything they can do to make that case, you know, at least triable in court where we can get a conviction. So, you know, there's a lot of people to thank. I just wanted to tell you that. We appreciate everything that you do. We appreciate everything that all these people do. And thank you for coming here and just listening to that part of it. I'm not the best sheriff in the country. I'm not the best sheriff in the state of North Carolina. But I'm passionate about what I do. I've been doing this for about 45 years. I love what I do, and I think that's what makes the difference in here. Everybody in here loves what they do and is concerned about what happens in Dare County, and it makes a big difference. It certainly does. So thank you for your time, and have a great day. Safe trip back to Raleigh.
Yes, he is. There was some time set aside for open discussion and question and answers. If anyone has any questions they'd like to put forth, there's some time set aside for that. And I also like to set aside some time at any time we have one of these gatherings for our chairman, Bob Woodard, if he has some comments he'd like to make. But if you have questions, please let them fly now. We'll take care of them. Somebody in here be able to answer them. Well, y'all must listen pretty good then. Daggone, I tell you what, it's not every day you get the Attorney General here, folks, so if you need to ask some questions, now's the time. We have one right behind you, Attorney General. Yep. Push that. Yes, sir.
Thank you again for being here. I know that there are some potential other lawsuits in the works with some other pharmaceutical companies, Purdue Pharma. Do you have any finger on your pulse of what that money is going to look like, when it's going to come, or how much of that we might be seeing in our state?
Only ballpark, because they're settlements in principle, but of these 3 generic companies which we've announced, it's about $8 billion, and the underlying settlement was 26, so it's about a third. And we haven't fully worked out the allocation among the states yet, but we think it'll be very similar to what the first go-round was. We haven't worked out the allocation among the counties, but we think it'll be very similar to what we've done in this one. And so essentially, our hope is that it's a third again on top of what we've had here. Now, the payouts, some are like 2-year payouts, some are 15-year payouts, some are 10-year payouts. So it's not going to be just this steady stream equal over 18 years. It's actually going to be, this website I told you all about, ncopioidsettlement.org, actually has the payout for every county in the state. So you know exactly how much per year is going to come in. And we're going to have to find some math genius at one of our schools to figure out how you layer in 5 years on top of 7 years on top of 12 years. So it's going to be complicated, but they're going to be meaningful additions. And our hope is that we finalize a number of these deals before the end of this calendar year, which would mean payments would begin in 2023. So our hope is what is clear is there are so many more good and valuable ideas than there is money. There just is. But the more money we can come up with, the more good ideas can be funded, and that's our ambition.
Anyone else? Don't be bashful. Attorney General Stein, once again, thank you for coming to Dare County.
It is my pleasure.
We really appreciate you being here. Thank you for taking time.
Thank you. Let me just say one closing word, which is what the sheriff said, passion and compassionate. It's almost palpable in this room in terms of the dedication that you all are bringing to this work. And I have to tell you, I think I do these things, one, to learn and one, to feel good. To know that there's so many people trying to help their residents live better lives is really heartwarming. And I just thank you for all that you're doing. And I'm so eager to see what you achieve. And thanks for having me today.
Yes, sir. Thank you. This is my chairman, our chairman. Now he can speak.
Nah, listen, this wouldn't have come to fruition. I, as Attorney General, Vice Chairman Overman, it's been probably, I don't know, I'm gonna get the years wrong, but it's been 3 or 4 years ago that he and Roxana got together and established a Saving Lives Task Force. And that was baby steps, but you've seen today how far it's going. The outreaches are just incredible. And our Board of Commissioners, there was a no-brainer for us to step up to the plate and fund this recovery court. Commissioner Bateman has just been relentless to make that happen. And when he brought that to us, it was I mean, it was just a no-brainer, you know. And to be quite honest, this ain't brag. This is fact. We get it done in Dare County. And thanks to Vice Chairman Overman for spearheading this. And you've heard it from everybody. You see the passion in this room. As a matter of fact, you probably don't remember it, but you saw the passion when I came to meet with the governor several years back over offshore drilling. I was in the room with you that day, and we had put the pressure on Mr. Zanke, and we prevailed. But that's how we do things in Dare County. We do it first class. It's no brag. Once again, it's simple fact. And I can't be any more prouder than every one of these folks sitting in this room that represent Dare County. And once again, thank you for agreeing to be here and listen to us and hear what we're doing. And hopefully, some of this you can share with other counties.
I will definitely spread the word.
Thank you.
Very proud of.
All right. Thank you, Vice Chairman.
Okay, everyone. Thanks, everyone, for coming. Appreciate you being here today. Thank you for your participation. Thank you so much.